Good afternoon. My name is Rafael Sanchez. I'm a student at the Doctor and Nurse Practitioner program in Ana G. Mendez University. Today, I'll be presenting on Deming Cycle. As previously said, today we're going to be presenting denim cycles. We're going to cover an overview of the denim cycle, background of the denim cycle, the benefits and purpose of its application in the nursing field, as well as the step. Also, you will find an example of denim cycle application in the nursing field. The Denim Cycle is a continuous quality improvement module designed to help organizations and professionals test changes, measure results, and implement lasting improvements. This framework is essential for driving consistent progress in quality and safety. It is built on four key steps: plan, do, check, and act. In healthcare, the Denim Cycle plays a vital role by guiding us to make evidence-based changes that improve patient safety, enhance outcomes, and increase overall patient satisfaction. The Denham cycle was developed by Dr. William Edwards Denham, an American statistician and professor who became widely known for his work and quality improvement. Denham originally adapted the concept from Schwartz's cycle, which was plan, do, check, act, but refining into what we know today. His work was first recognized in manufacturing, where the helped industry's improvement process and reduce errors, and later his model was applied in healthcare, education, and many other fields. Today, the denim cycle serves as foundations for continuous quality improvement across multiple disciplines, including nursing. Purpose and benefit. Denim cycle has several key purposes in healthcare. First, it supports problem solving by providing a clear method to identify and address issues, such as delays in care or high readmission rates. Second, it helps with standardizing protocols, ensuring consistency in care delivery. For example, it can guide adherence to sepsis bundles and other critical standards. Third, the cycle is a safe way of introducing changes. It allows providers to test innovations on a small scale before rolling them out widely, which reduce risks. Fourth, it strengthens training and development by helping refine nursing education programs, planning objective, evaluating performance, and adjusting content as needed. And finally, it promotes a culture of continuing improvement, encouraging nurses and staff at all levels to take part in quality initiatives. This leads to greater engagement, teamwork, and commitment for better patient care. The denim cycle, also known as PDCA cycle, provides multiple benefits in nursing practice. First, it leads to improved quality of care, enhancing patient experience and overall outcomes. Second, it contributes to greater patient satisfaction by improving both the quality and efficiency of care, which is often reflected in higher satisfaction scores. Third, the model helps to reduce medical error by systematically testing the evaluating protocols. Nursing teams can minimize both medical error and administrative mistakes. Four, it strengthens risk management. Testing changes on small scales allow teams to identify potential risk early before they result in serious problems. And finally, the PDCA cycle has been shown to reduce complications, and readmissions. For example, it has improved outcomes in hemodialysis patients and lower hospital readmissions rate overall. Together, these benefits demonstrate how powerful the PDCA cycle is for advancing nursing care and patient safety. The Deming Cycle is built on four key steps that repeat in a continuous loop of improvement. The first step is plan. This is where we identify a problem or an opportunity of improvement, analyze the causes, and design a clear action plan with measurable objectives. The second step is do. In this stage, we put a plan into actions on a small scale, of course, almost like a test run. This allows us to try out interventions, educate staff, and begin gathering information on how these changes are working. The third step is check, or sometimes called a study. Here, we carefully evaluate the results. We compare the outcomes against the original goals and review both data and feedback to see what worked well and what still needs improvement. The final step is act. Based on what we learned, we make decisions for the future if the changes were successful. We standardize them into routine practice. If not, we refine the plan and try it again. Together, these four steps plan, do, check, and act create a powerful cycle for continuous quality improvement in nursing and healthcare. Plan. In nursing, this means first identifying a problem or an area that needs improvement in patient care. Medication errors, infection control, or communication issues are some of the examples. Next, we gather baseline data, such as patient records, incident reports, or by direct observations. Then we analyze the root causes of the problem, often using tools like root causes analysis or a fishbone diagram. After that, we set clear and measurable objectives. For example, reducing patient falls by 20% within 6 months. We develop an action plan that outlines the interventions, assigns responsibilities, and set realistic timelines. It is important to engage the nurses team and other stakeholders such as patients, physicians, and management to ensure support and collaboration. Finally, we establish indicators and metrics to monitor progress and make sure the plan aligns with the facility policies and evidence-based practice. This completes step 1, plan. Step 2 of the Deming Cycle is do. This is where we put action plans into practice. We start by educating the nursing staff and other team members about the new interventions or protocols. Whenever possible, we apply the changes on a small scale first, like a pilot test, to see how they work in real settings. We make sure to document observations, track process, and note any changes that arise. Throughout this stage, we keep communication open with the team and with patients so adjustments can be done smoothly. Example of this is prevention of pressure ulcers development. The team implements a round of turning patients every 2 hours. Step of Deming cycle is check. At this stage, we evaluate whether the interventions are achieving the desired results. We compare the outcomes with the baseline data and with the objective set during the planning phase. We also gather feedback from both patients and staff to measure effectiveness and identify any gap. These steps help determine what worked well and what needs to be modified or improved. All findings are carefully documented for the next step. Step 4 of the Deming cycle is act. Here, we take the results from the check phase and make decisions about the future. If the intervention were successful, we work standardizing them into routine nursing practice. If the goals were not fully met, we revise the strategies and make the necessary changes. We also share the results with the wider care teams or organizations to spread learning. Finally, we provide continuous training and support so improvements are sustained and then restart the cycle for ongoing quality improvement. Here is an example of how the Deming Cycle can be applied in home health nursing. In the plant phase, I noticed that several patients with wounds were being hospitalized because of infection. After reviewing records, I found a poorly hand hygiene by nursing, patient, and caregiver was the major cause. My goal was to reduce wound-related hospitalization by 40% in 6 months. To address this, I developed an action plan that includes providing hand hygiene education, giving out infection control supplies, and using visual reminders to reinforce proper technique. In the do phase, I completed competency check of nurses in the field, tested this intervention with a small group of patients. During home visits, I demonstrate correct hand washing and sanitizer use, gave out written and visual guides, and encouraged patient nurses and caregivers to follow the step before the wound care is completed. In the check phase, after several weeks, I monitored infections rate and wound healing progress. I compared the new data with the baseline and also asked patients or caregivers for feedback about how easy it was to follow the hygiene practice. The results shows a reduction in wound infection and fewer hospitalization admissions. Finally, in the act phase, I standardized what worked. I made hand hygiene education part of every wound care visit and ensured the patients consistently had infection control supplies available. Both who still struggle, I added follow-up reminders and extra caregiver training. This example shows how Denim Cycle plan, do, check and act can directly improve patient safety in the home health nursing by preventing infections and reducing hospitalizations.